Dr. Dianne Reynolds Caine, Medical Director at the Daily Planet, and I'd like to say a few words about our electronic medical record. Okay, the Daily Planet uses an electronic medical record to keep track of all of our patient visits and all information that comes into the organization that relates to our patients. What's wonderful about the electronic medical record is there is a reliable place where we can always find this information on any particular patient. It decreases the number of staff needed to provide services to our patients because information that's needed is in one place and we don't have to ask staff to retrieve information from various places or to find information that is temporarily misplaced. The other advantage of having an electronic medical record as opposed to a written record is that there is a knowledge base at your fingertips. In other words, if you are interested in knowing what reactions might take place between any particular medicines you prescribe, you can look at your electronic medical record, who will summon up the information regarding adverse effects between medications and adverse effects between particular medications and medical diseases, and tell you what those adverse effects are so that you can make the decision as to whether or not the effect will be mild, moderate, severe, and whether or not the effect will negate your choice of medicine that you've put into the system, thereby allowing you to change that medication to something that's more complementary to other medications the patient's on, as well as the medical illnesses the patient has. The other bit of information that's at your fingertips regarding knowledge base is just basic information about any medical entities. You are able to enter the internet, to enter formularies of various insurers, so that one can prescribe those medications that again conform to the insurance coverage that particular patient has. Getting back to the piece on disease entities, you can access the internet and search information and download it so that you can give any particular information to a patient to better educate them about the medical problem that they're faced with. Another advantage of the medical record is that it allows connection to entities outside of your organization, such as pharmacies, labs, and studies have shown that 3 areas of the greatest benefit in medical records happens to be in the areas of pharmacy, because your prescribing of medications is expedited by any connection you might have with a pharmacy that fills the prescriptions for your patients. The other area, one of the other 2 areas that is found to be very beneficial with EMRs is labs. Again, if you're connected to a lab, when those lab results that are ordered come in on a patient, they can come in directly to the patient's record, so that again you don't have to handle so much paper and then record those results in the record. When you're connected to a lab, everything happens sort of instantaneously once those results are completed at the lab. And the last area where studies have shown that one has the greatest benefit with EMRs happens to be in the area of claims. When we finish seeing our patients, we providers here at the Daily Planet, there's a screen that we go to where we enter in our CPT codes. And in putting all of that information in, the claim is completed immediately after the patient's visit is completed, because that's when you finish your note. And so that expedites not only the submission of claims, but also the payment of those claims that are submitted. So the medical record is just great in all of those areas.